States attorneys generals move over because someone else wants to sue the federal government over the new health care law. On Friday, the National Federation of Independent Businesses joined 20 states that filed a joint lawsuit in Florida against the government. Joining us live is Karen Harnett, Executive Director of the NFIB Legal Center. All right, you joined this lawsuit with the states down in Florida. What is your basis?
Well, our basis is that we believe that the individual mandate in the law is unconstitutional. We believe that Congress, it's a bridge too far to require individuals, small business owners, to purchase health insurance just because they're alive, to act just because they're alive.
All right, I take it, I'm trying to sort of figure out, and I'll get down to the weeds and the issue of standing, but as to the people, the state's attorneys generals are representing the people. You represent small businesses, so it's got to be, are you saying that it's unconstitutionally applied to small businesses?
Yes, small businesses and all individuals, quite frankly. We have many members that are, sole proprietors. But yes, we believe that this law directly undermines a small business owner's right to own, operate, and grow their business, and we feel like it is our turn. We must take a stand against it because we believe it's unconstitutional and very detrimental to their ability to stay in business.
So are you saying that if you're a small business and you don't want to get health insurance, or you can't afford to give health insurance to your employees or whatever, that this law inhibits some right that you have?
Right. It is dictating how you spend your money. As a business owner, you have to either decide to pay for health insurance or pay the penalty, or that's more resources you're taking away from your business, your employees.
Doesn't the federal government, though, order you around on some things? You pay taxes, right?
Right.
So they can. I understand the different concept, the different thinking as it relates to attorneys generals in the states. I'm trying to understand, how you get, whether or not you're going to get bounced out of this or not.
No. Again, we have. It's also the individual freedom issue that I really think for the small business owners that we represent and talk to that is the most critical. That the fact that for the first time, simply because you exist, Congress is able to tell you what you must do. It's a bridge too far. If they can do this, then how far do you go down till you fall off the slippery slope? Do they have to tell you have to get a gym membership? Do they have to tell you what exercise regimen that you undertake? These are the things that are so fundamental to our freedoms as individuals and as small business owners living the American dream.
How many people in your organization?
NFIB represents about 350,000 small businesses nationwide.
Out of those 350,000, have you taken some sort of collective vote to see how many want to be in on this or don't?
Well, we have been surveying our members on health care generally for quite some time. And yes, we have received overwhelming support to get involved in this fight. From the second that the law was enacted, we started hearing from members saying, please, please fight this for us. And have our state, our people on the grounds, and all the 50 states, everybody has been hearing loud and clear from our members they want us to be in this fight.
Well, it'll be interesting to see whether you get bounced out of it, and of course whether or not the states get bounced out of it as well as this proceeds. It should be a couple months. Anyway, Karen, thank you.
Thank you.